Hey guys, welcome to another episode of the TG Wellbeing podcast. I'm Dr. Victoria Munoz, and this is Adam Santos. Today we're going to be talking about hormone decline and chronic disease. Hey Adam, it's good to be doing this again.
Yep.
It's been a while since we've actually done a podcast together.
True.
And I'm really excited to talk about this topic because chronic disease is on the rise. It has been increasingly getting worse over the last 100 years. A lot of that has to do with our environment, our foods, and other things. But hormone decline is a big part of that. And so that's what we want to talk about today because our TRT clinic offers solutions to this problem.
Yeah, exactly. And that's the cool thing that we have here is the TRT clinic, that we get to have a gym, have a place where people can come to be healthy, get fit, but also get their labs checked here. And it's super simple, super easy. That's some of the things we're going to discuss today, as some of the questions that some of you may have. So a question I do have for you, Dr. Victoria, is it true that what we see as natural aging is really a disease process?
Actually, it is. And then even though as the human species we do age and we do die, we're not going to live forever. Aging, as we know, is actually an early decline in hormone production, and also happening earlier and earlier than it should genetically. So, for example, we have multiple endocrine systems in the body. It's not just one system. We have thyroid, we have our gonads, our reproductive system, and in our gut, we have an endocrine system. In our brain, we have an endocrine system. So there's multiple endocrine systems that come together to create this hormone dynamic. With age, we're seeing a decline in these hormones that is unnatural in terms of the timing of things and how it happens. A lot of it has to do with our environment, the foods we eat, our processed foods that we seem to want to consume on a daily basis, the carbohydrates that we think we need for life, which we don't, and also environmental factors, endocrine disruptors, dirty water, other toxins in our environment, such as in our personal hygiene products, in our house cleaning products, in our toothpaste, for example. Fluoride is killing our thyroid gland and other things. So as these systems decline, they kind of decline together, even though maybe like when we run a hormone panel, we might see some things are still within normal range and other things are not. Typically what we see decline is T3, our active thyroid hormone, testosterone, growth hormone, which ultimately shows a decline in IGF-1. IGF-1 is how we measure growth hormone, and more on that later. And then estrogens with women. Estrogens go down with women, estradiol anyway. Estrone goes up, and we'll talk a little bit more about that. And estradiol going up in men. So we see decline in our sex hormones except for estrogen necessarily. And then what we see is an increase in cortisol and insulin with age. So we're seeing this shift that's causing more inflammation in the body, which ultimately is leading to more chronic disease as a species. We're not meant to have these disease processes. Before 100 years ago, before we started manufacturing our foods and eating a diet that is not appropriate for us, contaminating our environment, we didn't see these diseases.
Yeah.
So they're not genetic in nature. What they are is a result of our lifestyle, our environment, which is causing a decline in our hormones, which is causing us to be sick.
And has that decline really been the last 100 years? Like prior to that, were we a healthier human species?
Yeah, in general, even though in ancient Egypt they started farming and producing grain products, they were starting to see gynecomastia in men, this femininity in men, decline in muscle mass and strength, and as a result of consuming these grains. So, that was about 6,000 years ago. Since modern day manufacturing of foods and farming, we've been seeing chronic disease on the rise as a result of that.
Interesting. Very interesting. Always learning something with you.
Right.
Well, no, good stuff. Well, another one. So, and you kind of touched on this, but what disease processes do we see with hormone decline?
Yeah, so there's a multitude of chronic diseases we see with hormone decline that you wouldn't even think were related to hormones. What do we think of when we think of hormones? We think of sex hormones, testosterone, estrogen. And what do we think these are for? Reproduction and sex drive. Well, there's upward around 64 hormones in the human body, but we don't have to modulate them all, right? So, so diseases such as atherosclerosis, hardening of the arteries, sarcopenia, which is the wasting of muscle mass, diabetes, heart disease, stroke, autoimmunity, and then some of the more vague symptoms that we see with people that are known as common these days is like fatigue, lack of drive, lack of focus. Lack of drive can be just your determination in general, could be sex drive too. Muscle mass is going down, fat mass is going up, so people are having a harder time losing weight. And these are all a result of hormone decline.
And with all of that, I know I've personally had people that are maybe afraid to get on TRT, but they have all these symptoms that are showing that it could be, a hormonal issue.
Right.
And the question I get is, is it going to be safer to be on TRT or safer to just kind of ride it out? And what would your thoughts be on that?
There's a lot of bad information on the internet.
Yeah.
Let me just start with that, because, as many people as I see on a weekly basis, I do get these questions like, is hormone replacement safe? And especially with women, like, should I be taking estrogen, especially after menopause? Or should I be taking testosterone? Even I get that from men. Is testosterone safe for me to take? And will it inhibit my ability to produce my own? I'll say, well, first of all, you're not producing your own right now.
Yeah.
Look at your numbers.
Yeah.
And secondly, the hormones that we use are bioidentical.
Yep.
So they're exactly the same molecular structure as what our body produces naturally. In addition to that, it's hormone decline that's causing the chronic disease. So I'm not saying that's the only thing that causes chronic disease, but with every disease, there is an imbalance in hormones. With every chronic disease, whether it's cancer, whether it's autoimmunity, whether it's heart disease, there is an imbalance in hormones. Number one. Number two, when we're at your optimum, 18 to 20 years old, right?
Yeah.
That short window of time is when our hormones were at their optimum. Not considering somebody who's been exposed to some kind of environmental toxin or something severe like that.
Yeah.
But in general, 18 to 20 is when we see our hormones at their optimum. We don't see chronic disease at that age. It's when we get older and our hormones go out of balance is when we start seeing disease. So we do want to optimize and we do want to modulate hormones later in life. Now, I will say this, the earlier the better, because the longer you let it go, the more damage you're going to do to your cells, and those cells being mitochondria specifically. Mitochondria is the metabolic engine of the cell. And so that is the basis of all disease. When the mitochondria becomes damaged, then we start to see cancers, all these diseases that I've mentioned previous, right? So the sooner we catch it, the less damage to our mitochondria, the better. It can be repaired to a point, but there's a certain point of, not of no return, but sometimes we can get the patient 75% better.
Yeah.
And sometimes we can completely get the patient better just with lifestyle modifications, but that's pretty rare because by the time patients are having symptoms, they've been sick for a good 20 years and they haven't known it. And then at that point, the damage is already done.
Yeah.
Doesn't mean that, like I said, that it can't be repaired or that we can't bring the patient into balance, but it's often, in addition to lifestyle changes, we have to do hormone replacement as a result. Now, doing the hormone replacement is going to optimize your health. It's important to have optimal hormone levels no matter what your age, because as they decline, so does your quality of life, so does your susceptibility to chronic disease go up, and so does your longevity goes down. That's why we're living, on average, maybe 80 years old. Yeah, we're genetically, it's proven that we should be living to at least 120 years old.
Yeah.
And not dying of chronic illness like cancer. Many doctors and scientists will say, well, if you live long enough, you'll get cancer. Well, that's because of our lifestyle and our environment. It's not because of our genetic makeup, our DNA as a human species. We're not meant to get cancer ever.
And with all of that, obviously there's physiological effects that are happening with decline in hormones. There's the disease that can come up, but psychologically, what happens with hormone decline? Is there any psychological effects that can occur?
Absolutely. In fact, brain health suffers. So we see a decline in brain health and brain function, as well as with the immune system as hormones go down. Like I said, there's about 64 hormones in the human body. We're not modulating all of them. There's a few key players at the front end that we want to address, and as a result, downstream, everything works well, right? It's kind of like we've talked about cholesterol in the past, and how cholesterol is at the top of the pathway in the production of our sex hormones, for example, right? And so if our cholesterol is not addressed, and meaning we want high cholesterol, right? Not high triglycerides, but we want high cholesterol, then downstream, our hormone production is way better, naturally. So when doctors are putting patients on these statins and other medications that are suppressing cholesterol, they don't have any education in diet, so they just say, eat whatever you want and take this medication. Well, you're not fixing the metabolic problem. So they may be on a medication that's suppressing symptoms, but in the background, they're getting sicker and sicker. And they're on, by the time they come see somebody like me, they're on a list of medications like this because their doctor didn't properly educate them on, what's going on with their body, because a lot of these doctors don't know anything about metabolic health. They're not educated in that. And they're just trained to give pills for symptoms.
Absolutely. And that's one of the things I really respect about you, is you're not just trying to patch the problem. You're trying to figure out the core of what the issue is and really heal the individual. I know you mentioned there's 64 hormones in the human body, not modulating all of them, but my understanding is for at least for assessing for TRT, in that aspect, testosterone, estrogen are going to be pretty important markers to be looking at. I'd imagine there's some differences between men and women, though. What are you looking for between like a male and a female in terms of that testosterone and estrogen?
Yeah, so I want to start out by saying that men need estrogen and women need testosterone, just in different levels. So both men and women need testosterone, and they both need estrogen. And if men don't have estrogen, their fertility goes down. Because estrogen does play a key role in sperm production, for example. So and the estrogen that we're specifying here is estradiol. So there's 3 different estrogens. There's estradiol, estrone, and estriol. The other 2 are primarily with women. The estradiol is men and women. So specifically estradiol, when men should have higher testosterone, right? The average total should be between 700,000. And their estradiol should be low, but not negligible. So I like them around 15 to 25 for their estradiol. And so for women, it's different, right? Their testosterone levels are lower, but estrogen is higher. Now, we also don't want estrogen dominance in women either. Estradiol gets too high and women can have problems as well. So we want everything within a proper range, an optimal range. And so with that being said, if men's estradiol goes up, then we start seeing problems such as gynecomastia and the issues you may see in women, like PMS type symptoms, the emotional, the crying, and it's a real thing, and I've had men that say, my wife kept saying, why are you so moody? Why are you being this way? Why are you on the verge of crying? I don't know. And then they come see me and we run their blood work and their estradiol's off the charts. And, genetically, some men will aromatize with age. Some won't necessarily. We do want to monitor it when we start TRT, because as we start giving the testosterone exogenously, meaning through a medication, that testosterone could start going down the estrogen pathway. So we have to keep an eye on it. If they do start to aromatize, it's a real easy fix. We just give an aromatase inhibitor, and it just blocks that pathway, is all it does, with virtually no side effects at all. So when we do this, and when we get the male within a good range of estradiol and testosterone cypionate to be specific, then they just feel amazing. They don't get sick, they don't have chronic disease. and they just have this quality of life that they didn't have before.
Yeah.
With women, we can see testosterone go really high in some women, and that's usually related to something that's called PCOS, which is polycystic ovarian disease. What happens is with inflammation in the body, this can occur, and these cysts will develop on the ovaries and cause an increase in production of testosterone. Because ovaries are responsible for the production of testosterone in women. So when these cysts are on the ovaries, it just stimulates excess production.
Interesting.
And then, some of the signs are, facial hair growth.
Yeah.
And male pattern symptoms.
Yeah.
Right?
Yeah. No, absolutely.
Yeah.
And with all that, I mean, obviously what you're looking at is the blood panels to see, are people optimized, or are they not optimized? And for the most part, people coming to see you are usually on the not optimized, area. And that's typically why they're coming to see you.
Right.
And I understand that, being low with your hormones, testosterone, estrogen, or being off, I should say, not necessarily low, but being off, particularly low for males, testosterone can lead, again, to a lot of diseases, maybe cancers, et cetera. Yeah. But is there any effect with like hormone replacement therapy in cancer itself? Because I have seen, maybe not true research, but that, hormone replacement therapy can lead to cancer and other diseases as well. But do you have any, insight on that?
Yeah. So, yes, it can if you don't do it right.
Yeah.
That's why it's important to work with a doctor who understands this. So like with women, as they go through menopause, now there's different changes that affect the human body physiologically with the change in hormones. Menopause is one. Andropause, right, is another one. Somatopause, that's when growth hormone goes down, for example.
Yep.
And adrenopause, that's when the adrenals start declining in their production of DHEAS, right?
Yep.
Which is also responsible for hormone production or testosterone production. So hormone replacement in cancer. With women and estrogen after menopause, it is ideally you can replace and optimize the estradiol. What happens is with menopause, estradiol goes down, which is our fertility hormone, and supports, reproduction, and estrone will go up. So estrone is inflammatory. It's the more inflammatory estrogen, and that's why we see more chronic disease after menopause as a result of this estrone going up. So it's good to modulate it. That's something that I do with some of my female patients. However, what we can do is we can address this inflammatory process with just testosterone with women. And that's something I talk to my patients about when they come see me, is how if we optimize testosterone, we can help balance this out. Because we really don't need estrogen after a certain point at the same levels that we did when we were in our childbearing years. However, it's more of the shift in hormones with the aging process as we know it, which is more of a disease process, where we start seeing cancers. For example, with men, testosterone doesn't cause cancer with men. Yeah. It's the increase in estrogen, or it's the imbalance of testosterone to estrogen with men. That's when we start seeing male patterned disease. Yeah. Otherwise, we'd see cancers early in age, like at the age of 18, if testosterone was truly a cause of male pattern cancers. It's not. Yeah. And at that age, men usually have a good balance of their estradiol and their testosterone. Same with women. Estrogen and testosterone are at a good, balance. However, with women, the decline in the estradiol after menopause, it's not really necessary to replace that to its optimal levels, because with women it's a little different, where because it was meant for fertility and reproduction, that we can actually do the same thing with the testosterone at that point and get a really good result without the estrogen being a player in that. Yeah. And
it's interesting how really all the hormones affect each other, and again, that's why it's crucial to have somebody like yourself reviewing the panels, because you're going to be able to diagnose, well, testosterone might be optimized, but estradiol or the thyroid or some other hormone could be off. That could be causing a lot of these changes or issues that are going on in the human body itself. And with that, said, obviously both imbalanced hormones and balancing hormones, I'm sure there's going to be changes going in the body, good and bad.
Yeah.
And I guess more specifically, if any side effects that somebody might have from non-optimized hormones, or even maybe being on hormone replacement therapy, there are potential side effects that could come in, like estrogen increasing in men being on TRT. But then you have aromatase inhibitors that can help with that. But of these changes that occur, are they reversible? Are they preventable? Is there certain things or routes that you take to prevent any unnecessary or unwanted changes in the human body?
Yeah. So first of all, the decline in hormones is preventable
Yeah.
and reversible. I recommend that people come to me before they start having symptoms. The reason for that is because before you start having symptoms, your hormones are declining a long time before you become symptomatic. Once you become symptomatic, it can be very gradual, especially for men, because testosterone starts declining at between 20 and 30.
Yeah.
That's pretty early on.
Yeah.
You might not notice it till you're 40 and you're just like, can't get rid of this, and
Yeah.
I don't feel good. Sex drives in the tank. I can't get any gains in the gym.
Yep.
I'm tired. I need a nap halfway through the day. These are things that they start to complain about after the hormones have just declined over time.
Yeah.
And same with women, except that the change is more dramatic with women. Typically, menopause is like after a year of not having a menstrual cycle, that's when a woman is in full menopause, but they start with perimenopause, where they start having these uncomfortable symptoms, and then it's just boom, it hits them pretty hard.
Yeah.
But men and women both go through hormonal changes. It's just a little bit different. It is absolutely preventable.
Yeah.
People come to me, I say, come to me at the age of 18, start looking at your hormones, let's modulate them, let's make sure that we keep them optimized so that they don't decline and go into the tank. You're going to have the best health outcome at that point, because what we've done is we've mitigated metabolic damage to the cell. Once you've gotten to the point where you're symptomatic, there is some damage to the cell, to the mitochondria, but we can reverse it to a point. It may be all the way, depends on how early on, in the process people come to me. But often, even with lifestyle changes, we still have to do TRT at that point. But it is absolutely recommended, because if you don't replace the hormones exogenously, like through prescription, then you're going to have worse problems down the road. So yeah, it can be prevented, it can be addressed once it starts, and nobody should have declining hormones through their lifetime. If you're 80 and your hormones are in the tank, you should still come see me to get your hormones optimized. And guys will say, well, I'm not really looking for a gal, or somebody to, a partner. That's okay, because there's other reasons you need to optimize your hormones.
Absolutely.
And it has to do with your health, chronic disease, dementias, your immune system. And as your immune system declines, you're even more susceptible to chronic disease. So it just becomes this vicious cycle of chronic illness and decline in your quality of life.
Yeah. And just another question I have with somebody young, an 18-year-old per se, that's coming in, for the most part, I'd imagine their hormones are pretty optimized. What are you looking for along their aging what markers are you looking for? Obviously, I'm sure testosterone and estrogen, but how would you be able to catch that soon? And when would be a good time to implement TRT? Is like the instant it starts dropping, or is there a certain level you're looking for, certain imbalances you're looking for to say, hey, you do need TRT to be optimized?
So for my younger patients that come in and their hormone panel looks really good, we want to look at other things too. Like we want to look at their diet. We want to look at their exercise, sleep, stress. We want to look at everything that kind of equals lifestyle, right? And so if they're eating fast food, they can get away with that for a while, but they are doing metabolic damage. We're just not seeing the effects of it yet.
Yeah.
So we want to address things early on like that and say, look, this is what you're going to be looking at if you don't change these things. By changing these things, they can prolong the decline in the hormones. They can prolong what we know is the aging process, which is actually a disease state, right? And we can really help to keep them optimized. And then when we do see some changes, we can address it, whether it's with lifestyle or with hormone replacement. but when their levels just start to go down slightly, especially at early on, if they've been working with me all along, I'm not likely to put them on like a TRT, for example, right away.
Mm-hmm.
There might be other things that I do to help boost their natural production.
Yeah.
But one thing that's important to understand is that when we start replacing hormones at a therapeutic level, our own personal physiological production doesn't suppress it.
Mm.
We only see that with some of these athletes that are doing stacks of anabolics that are when they're doing really high levels of these hormones, these anabolics. That's when we see the production of their natural hormones suppressed.
Interesting.
So even my male patients are like, yeah, we want to get pregnant, but we see their testosterone's in the tank. Typically, it's not going to affect fertility, but there are things we can give them in addition to that to make sure that they're able to conceive and have optimal health.
Mm.
We shouldn't have to let their hormones, their testosterone go in the tank for the purpose of conceiving a child, yet are they really going to be able to conceive?
Yeah.
Their hormones are not optimized either.
Exactly.
And often their estradiol is affected, which is also important again for the production of sperm. Mm. So we really have to take all these things into consideration and optimize the patient and keep an eye on things. And that's why it's really important to not try to do it yourself. Some people are out there taking even supplements. Yeah, the supplement said it would help boost my testosterone. Stop it. It's not. It's just making you sick. Yeah.
Oh, very interesting. Well, thank you, Dr. Victoria. Very informative as always. Always appreciate the conversations, always learning. So that was amazing. That was good. Thank you.
Yeah, thanks for being here.
Yeah.
And join us next time for another episode of the TG Wellbeing podcast, where we're going to bring you more really good topics on hormones and health. I'm Dr. Victoria Munoz. This is Adam Santos, and see you next time. Boom.